A very good morning to all the doctors and everybody who have joined the webinar today. It's a pleasure for us to have you all here. This is Dr. Shivangi Singh, and I feel very fortunate that I've gotten this opportunity to present the topic how to get rid of acne vulgaris with Radaropus software. And I'm very thankful to the BJNRX and BJN publication for giving me this opportunity to present this topic in front of you all. So let's begin with the introduction part. Now, the definition: acne vulgaris is an inflammatory disorder of pilosebaceous unit which runs a chronic course and it is self limiting. Acne vulgaris is triggered by Cutibacterium acnes in adolescence under the influence of normal circulating dehydroepiandrosterone. Acne is a skin condition that occurs when your hair follicles become plugged with oil and dead skin cells. It causes whiteheads, blackheads, and pimples. Acne is most common among teenagers, though it affects people of all ages. It is a very common skin disorder which can present with inflammatory and non inflammatory lesions, chiefly on the face, but can also occur on the upper arms, trunk, and back. Basically, acne vulgaris is a skin condition that occur when hair follicles are blocked with dead skin cells, bacteria, and oil that we call sebum. The blocked follicles causes blemishes on the skin, including pimples, blackheads, whiteheads, and cysts, also known as common acne. One of its main causes is hormone, especially around puberty. Acne vulgaris is a common cutaneous disorder characterized by chronic or recurrent development of papules, pustules, or nodules on the face, neck, trunk, and proximal upper extremities. The pathogenesis of acne vulgaris involves the interaction of multiple factors that result in the formation of comedones and the development of inflammation. Now, moving on, next slide. Incidence. Acne is a most common encountered skin condition in adolescents and young adults between ages 12 and 35 years. Both genders are affected equally, although onset is slightly earlier for girls. Acne become more marked at puberty and during adolescence because the endocrine glands that influence the secretions of the sebaceous glands are functioning at peak activity. So this was all about incidence. Now moving on, next slide. My next slide is about etiology. Acne occur by hypersensitivity of sebaceous glands to a normal circulating level of androgens, which are aggravated by P. acnes and inflammation. That is pilosebaceous acnes and inflammation. The most common trigger is puberty. Basically, during puberty, surges in androgens stimulate sebum production and proliferation of keratinocytes. Other triggers includes hormonal changes that occur with pregnancy or the menstrual cycle, occlusive cosmetics, cleansers, lotions, and clothing, high humidity and sweating. So the use of medication like lithium steroids and anticonvulsants, exposure to excess sunlight is also comes under the etiology part. The uses of occlusive wear like shoulder pads, headbands, backpacks, and underwire braziers. Endocrine disorders like polycystic ovarian syndrome, that we call PCOD or PCOS, and even pregnancy. The genetic factors affect the percentage of branched fatty acids in sebum Heritability estimates ranges from 50 to 90%. So this was all about etiology. Now moving on next slide. My next slide is about epidemiology. So acne may appear in adolescence and it persists through the early 30s. Acne is more common in males than in females. Urban population are more affected than rural population. About 20% of the affected individuals develop severe acne, which result in scarring. Some races appears to be more affected than others. Rush, Asians and Africans tend to develop severe acne, but mild acne is more common in the white population. So, in general, populations with darker skin also tend to develop hyperpigmentation. Acne can also develop in neonates, but is most but in most cases resolves spontaneously. So it affects nearly 90% of people in Western society during their teenage years, but can occur before adolescence and may persist into adulthood. While acne that first develop between the ages of 21 and 25 is uncommon, it affects 54% of women and 40% of men older than 25 years of age and has a lifetime prevalence of 85%. About 20% of those affected have moderate or severe cases. It is slightly more common in females than males. Acne affects 40 to 50 million people in the United States and approximately 3 to 5 million in Australia. So, this was all about epidemiology. Now, moving on, pathophysiology. So, the pathophysiology is during puberty, androgen stimulates the sebaceous gland, causing them to enlarge and secrete a natural oil, sebum, which rises to the top of the hair follicle and flows out onto the skin surface. So, in adolescents who develop acne, androgenic stimulation produces a heightened response in the sebaceous gland so that acne occur when accumulated sebum plugs the pilosebaceous ducts. This accumulated material forms comedones. So during puberty, under the influence of androgen, sebum secretion is increased as 5 alpha reductase converts testosterone to more potent DHT, which binds to specific receptors in the sebaceous glands, increasing sebum production. This leads to an increased hyperproliferation of follicular epidermis. So there is retention of sebum, distended follicles rupture and release pro-inflammatory chemicals into the dermis, stimulating inflammation. So Staphylococcus Staphylococcus epidermis and Malassezia furfur induce inflammation and produce follicular epidermal proliferation. Now I'm going to discuss about the factors that aggravating acne includes basically foods with high glycemic number like dairy products, which also contain hormones, junk food and chocolate, which causes insulin like growth factors that stimulates follicular epidermal hyperproliferation. Next one is oil based cosmetics and facial massages. Then premenstrual flare up in acne seems to follow edema of the pilosebaceous duct. This occur in 70% of female patients. Severe anxiety and anger may aggravate acne probably by stimulating stress hormones. Now moving on next slide, types of acne. So I'm going to discuss the types. The first one is fungal acne, that we also known as Pseudosporium folliculitis. Fungal acne occur when yeast builds up in your hair follicles. These can be itchy and inflamed. Next one is cystic acne. Cystic acne causes deep pus-filled pimples and nodules. These can cause scar. Basically, cystic acne is another severe form of acne vulgaris. Like nodules, the pimples are inflamed and go deep into the skin. They can be very large and are filled with pus. Now, the next is hormonal acne. Hormonal acne affects adults who have an overproduction of sebum that clogs their pores. Next one is nodular acne. Nodular acne is a severe form of acne that causes pimples on the surface of your skin and tender nodular lumps under the skin. So, nodular acne is a severe type of acne. Nodules are bigger than typical pimples. They go deep into the skin and causing inflammation. Breakouts can be widespread and painful. In addition, nodules are hard to touch and do not contain pus. Next one is papule. In papule, if the pimple does not have pus, it is called a papule. Last one I'm going to discuss that we don't have in the slide, that is pustular. So in pustule acne, when bacteria get trapped in a pore along with dead skin cells and oil, it forms a pimples. These may swell and look inflamed. If the pimple has pus inside, it is a pustule. Now the next type is whiteheads. This is one type of blemish known as comedons. Whiteheads look like small raised white or skin colored bumps. They occur when oil and dead skin cell clogs the pore. This is also known as closed pore acne. Blackheads. With this type of comedons, the buildup of oil and dead skin widens the pore so it looks open. The substance in the pore reacts with oxygen to form a black color. This is known as open pore acne. Now moving on next slide, that is symptoms. Now the symptoms includes whiteheads, which are closed plugged pores, whiteheads which are open plugged pores, tender red bump called papules, pustules which contain pus, painful lumps beneath the skin called as nodules, and cystic lesion. So acne is a result of blockage of the hair follicle in the skin. This blockage usually involves oil or skin cells. You may notice one or more of the following symptoms. These outbreaks may not be limited to the face. They may also occur on the back, shoulder, neck, and chest. So this was all about symptoms. Now moving on my next slide, that is risk factors. Now the risk factors includes ages. People of all ages can get acne, but it's more common in teenagers. In hormonal changes, such changes are common during puberty or pregnancy. Family history, genetics play a role in acne. If both of your parents had acne, you are likely to develop it too. Greasy or oily skin substance. You may develop acne where your skin comes into contact with oil or oily lotions and creams. Friction or pressure on your skin. This can be caused by items such as telephones, cell phones, helmets, tight collars, and backpacks. Now I'm going to discuss a point that is triggers of acne. So triggers contain like certain thing in your environment contributes to acne, or they can make an acne breakout worse, and including wearing tight fitting clothing and headgear like hats or sports helmet, air pollution and certain weather changes or conditions, especially high humidity, using oily or greasy personal care products like heavy lotions or creams, or working in an area where you routinely come in contact with grease, such as working at a restaurant with frying oil, stress, which increase the hormonal cortisols, a side effect of a medication, or last one is picking at your skin or your acne. So this was all about risk factor. Now my next slide is lifestyle changes. So the first point is protect yourself from sun. Many acne medication will increase your sensitivity to the sun and make you more likely to get a sunburn. Don't pick at any acne lesion or touch them. Picking acne can result in scarring. Exercise. Exercising is a great way to minimize the stress. Wash your face. Not more than twice each day with warm water. Mild soap made easily for especially for acne. If acne is one on the back, shoulder or chest, try wearing loose clothing to let the skin breathe. Avoid tight garments such as headbands, scarves, or wash them regularly if used. Avoid anxiety and stress as it can increase production of cortisol and adrenaline which exacerbate acne. Try to keep cool and dry in hot and humid climate to prevent sweating. Now I'm going to discuss some more points about the lifestyle changes. You may wonder what lifestyle changes you can add to your topical or oral drug regimens. So here are some to keep in mind. So, avoid food that may flare acne. There's evidence to suggest that cow's milk and food that have high glycemic index may cause acne to flare. So, I'm going to discuss the basic things. Do not scrub the skin or burst the pimple, as this may push the infection further down and causing more blocking, swelling, and redness. Avoid popping pimples, as this makes scarring likelier. Hold the telephone away from the face when talking, as it is likely to contain sebum and skin residue. Wash hands frequently, especially before applying lotion, creams, or makeup. Clean spectacles regularly as they collect sebum and skin residue. Choose makeup for sensitive skin and avoid oil based products. Remove makeup before sleeping. So, this was all about acne. So, this was all about acne from my part. Now, I'm going to discuss a live case with you all. Now, I'm going to start my case presentation. A female patient of age 27 years reported at my clinic with the chief complaints of pustular eruptions over face since 2 years. These are observed to be maculopapular eruption, a few nodules and pustules on face, foreheads. Eruptions are very painful on touch with marked redness. There's itching with oozing of yellowing discharge with bright redness, and after scratching, eruptions get bleeds and excoriated. Skin is oily and it leaves scar marks after itching and aggravation in warm and amelioration after scratching. So the history of present illness, the patient was apparently well 2 years back when she suffered from pustular eruption on face and forehead was from last 2 years. But since 1.5 year it was gradually increased and it became papules as well as pustules and require 15 to 20 days to disappear. The patient had taken allopathic treatment for this complaints 2 years before. The treatment included the external application of acne or for acne, which was discontinued by the patient on her own, as this used to give only temporary relief and later on led to marked dryness and exfoliation of skin and irritation. Eruptions are very painful on touch with marked redness. Past history. She had suffered from allergic rhinitis in early childhood. She had a past medical history of peptic ulcer 4 years back, took allopathic treatment and got relieved. In family history, the father suffering from hypertension and some psychological disturbance also. And the mother is having hyperthyroidism, taking allopathic medicines. Mental journals, he's also she's also angry in nature, especially when she thinks about her past events. Desire for alone, reserved in nature, she gets irritated easily since the complaint started, cannot collect her thoughts or find the right words. She gets irritated easily since the complaint started. Now moving on physical journals. Now the physical journals of my patients are the thermal reaction, hot temperament, appetite. She has good appetite, taste, desire for sweet, and aversion to meat. Perspiration, profuse, on face, non offensive, non staining. Thirsty. So in thirst, patient is thirsty, large quantity for cold water, urine, normal micturition, stool, normal, satisfactory, once in a day, sleep, disturbed due to itching, dreams, not specific, nothing is specific. So I'm going to the next slide, that is gynecological history. Menarche at the age of 13 years, cycle and duration 6 day, flow was normal. On physical examination that I have observed, her BP was 110 by 60 mm of Hg, pulse rate was 78 beats per minute regular. Pallor was evident from the face and conjunctiva. Her weight was 55 kg and height was 159 centimeters. No further abnormality were detected on a brief examination. So thank you so much for staying with us. We will be starting the presentation and training. How can we repertorize this case with the help of Radaropus? I will be sharing my screen to all of you. So this is Dr. Shivangi and I will be demonstrating you all about how you can get started with Radaropus and how can we repertorize the case. So before I start, let me explain to our viewers how this interface works. On the right hand side panel of your screen, you have a short chat box. You may type your question or whatever message you have right there and press button next to it to send it to us. Okay, now I'm going to start my presentation. I'm going to repertorize my case with the help of Radaropus software. So whenever you open your Radaropus software, it will open on your main document screen exactly like this. Synthesis Adonis repository is open by default. Synthesis repository is exclusively available in Radaropus software. The above icons are known as icon bar or toolbar. These icons and these five icons which are present on the left hand side of your screen are known as primary icons, consist of repositories, references, patient management, remedies, and families. Now I'm going to start my repertorization. So for repertorization, first of all, I'm going to this repositories icon. If you click on this icon, you'll get the list of repositories. Radar comes with multiple repositories. So today I'm going to do my repertorization. One more thing I'm going to tell you before starting my demonstration on this repertorization. So whatever repertoire you want to open, you can scroll, else you can search with the help of this search bar, search for repertoire. You can write down the name of the repertoire that you want to search in the search bar and you'll get the result. So today I'm going to do my repertorization from Synthesis Adonis repertoire. This repertoire is a successor version of Synthesis Treasure Edition. So the number of rubrics and remedies have been increased in this Synthesis Adonis repertoire. Now my Adonis have open on my main display screen. So basically for doing the repertorization from this repertoire, I will be needing few icons. The first one is this binocular, find rubric. If you click on this binocular, you will get this navigation window. It contains all the chapters that belongs to this particular repertoire. So my First symptom, basically, I'm going to take the first symptom of my patient is having company aversion. So company aversion, basically, patient wants to be alone all the time. So patient is having company aversion. Company aversion is a mental symptom. I'm going to the mind chapter. If you click on this mind chapter, you'll get all the rubrics that comes under the mind chapter. So you can scroll your rubric and search, else you can search with the help of this search bar. Start typing the first letter of the rubric you wish to see. In front of this, write down your symptom. My patient is having company aversion. Just write down the initial, you'll get your rubric below. Aversion to is already mentioned here. So just click on it. Now enter. Press enter button on your keyboard. Now my rubric have opened on my main display screen from mind chapter. Company is my rubric. Aversion to is my sub rubric. We have multiple clipboards here. They're just like our repertorial sheet. For doing your repertorization, you have to add your rubric into this clipboard and it will automatically get repertorized. So for taking any rubric into the clipboard, we have three methods. The first one is dragging and dropping. With the help of your cursor, you can drag it and drop it. The next two method I'm going to tell you with my two subsequent rubrics or the next subsequent rubrics. The next symptom of my patient is reserved in nature. So I'm going to the mind chapter again. I'm typing here reserved. Just write down the initial, get your rubric below. Press enter button. Now my rubric have opened on my main display screen from mind chapter. Reserved is my rubric. Now I'm going to add the second rubric into the clipboard with the help of second method. And my second method is plus button. The plus button on your keyboard is the second method. As soon as you press your plus button, your rubric is added to the clipboard. Okay, the next symptom I'm going to take. My patient is was always angry about the past event she had. So I'm going to the mind chapter again. Anger. Past events about. My rubric have opened on my main display screen from mind chapter. Anger is my rubric. Past events about is my sub rubric. So I'm going to add this rubric into the clipboard with the help of third method. And my third method is this icon. Take the current rubric icon next to this binocular. As soon as you press this icon, your rubric is added to the clipboard. Now I'm going to take my next symptom. Patient is having the eruption on face, basically having the acne on face or forehead. So I'm going to the face chapter first. Face, eruptions, acne. My rubric have opened on my main display screen from face chapter. Eruptions are is my rubric and acne is my sub rubric. Now I'm going to add this rubric into the clipboard with the help of first method. And my first method is my first method is drag and drop method. Okay, now I'm going to take my next symptom. The patient is having pustules. The eruptions are like pustular. So the eruptions was like pustular eruption. I'm going to the face chapter again. Face, eruptions, pustules. Now press enter button. Now my rubric have opened on my main display screen from face chapter. Eruption is my rubric, pustules is my sub rubric. Now I'm going to add this fifth rubric into the clipboard with the help of second method, and my second method is plus button. Plus button on your keyboard is your second method, as I told you earlier. Now my rubric is added to the clipboard as soon as I pressed my plus button. The next symptom I'm going to take. The eruptions are was painful to touch, having aggravation while touching and painful. So I'm going to the face chapter again. Face, eruptions, painful. touch aggravation. Now my rubric have opened on my main display screen from phase chapter. Eruptions is my rubric. Painful touch aggravation are my sub rubric. Now I'm going to add this rubric into the clipboard with the help of third method, and my third method is this icon. Take the current rubric icon next to this binocular. As soon as I clicked on this plus on this icon, my rubric is added to the clipboard. The next symptom I'm going to take, the patient is having aggravation in warmth, having aggravation in itching from warmth. So I'm going to the phase chapter again. Eruptions, itching, warmth aggravation. Now a rubric have opened on my main display screen. I'm going to add this rubric from phase chapter, that is from phase chapter eruptions, itching, warmth, aggravation. I'm going to add this rubric with the help of first method, that is drag and drop. You can drag it and drop it with the help of your cursor. The next symptom I'm going to take, the patient is having the acne on forehead. So I'm going to take the next symptom, that is from face chapter, face eruptions, acne, forehead. My rubric have opened on my main display screen from face chapter, eruptions, acne, forehead. My rubric is here and I'm going to add this rubric into the clipboard with the help of second method. And my second method is plus button on your keyboard. Now my rubric has been added to this clipboard. I'm going to take the next symptom. The patient is having bleeding when scratching, when the patient is scratched, having aggravation or having the bleeding after scratching, as we say this. I'm going to the face chapter. Eruptions, bleeding, scratched when. I'm going to add this rubric into the clipboard with the help of third method, and my third method is this icon. Take the current rubric icon next to this binocular. Now my rubric is added to the clipboard. Now the next symptom I'm going to take, my patient is having the desire for sweets. So I'm going to the genetics chapter. You'll get your desire and aversion in this genetics chapter basically. Food and drinks. We have this chapter. Now patient is having desire for sweets. I'm typing here sweets, desire. Now I press enter button. Now my rubric have opened on my main display screen from genetics chapter, food and drinks, sweet desire. I'm going to add this rubric into the clipboard with the help of first method, that is dragging and dropping. The next symptom I'm going to take, the patient is having aversion from meat. So I'm going to the genetics chapter again. As I told you, you'll always get your desire or aversion related to foods, substances in this genetics chapter, food and drink chapter, food and drinks chapter, meat, aversion. Now my rubric have opened on my main display screen from genetics chapter, food and drinks is my rubric. Meet a version, I'm a sub rubric. Now I'm going to add this rubric into the clipboard with the help of second method, and my second method is plus button on your keyboard. So as soon as you press your plus button, your rubric is added to the clipboard. Now I've taken all the rubrics. Now suppose you want to go to your analysis or your reportization, just click on your clipboard and you'll get your reportization, you'll get your analysis, you'll get your chapters, rubrics, sub-rubrics, and you'll get your probable remedies and you'll get your grading accordingly. So I'm going to tell you this. We have taken 11 rubrics here. So sulfur cover all the 11 rubrics and the total is 22. If you add these numbers like 2 plus 1 plus 3 plus 1, 1, the total will be 22. Hipparself cover 8 rubrics out of 11 and the total is 16. Now I'm going to tell you the next one is if you want to read any remedy from your probable remedy list, so you can open it directly from this repertorial sheet. No need to go to this references or remedies icon, just read your remedies from here directly. Like suppose you want to read this sulfur, so double click on your sulfur and your sulfur would open on your main display screen and you can read it from here. Basically, our software is all-in-one interface, so whatever icon you open will remains open in different tabs. Suppose you want to go to back to your analysis, so in this tab we have our analysis icon remains open. I'm coming back to my analysis. Suppose you want to read this belladonna from this list, so just double click on your belladonna and your belladonna have opened on your main display screen with the multimedia image of the plants. I'm going back to my analysis. So this was all about repertorization analysis, how you can find your rubrics with the help of synthesis Adonis repertory or with the help of Radaropus software. So this was all about acne and how you can repertorize a case from my part. Now moving on my prescription part. So the medicine I have selected, that is sulfur 200, 6 globules, 9 hour IV followed by placebo 30. 4 pills TDS for 10 days was prescribed on first visit considering the repertorial totality and the patient improved symptomatically. So the general management I have given to my patient that along with the homeopathic medication the patient was advised regarding relaxation techniques for mental relaxation and basic practices for hygiene, especially of the face, like frequent washing the face with lukewarm water. So the next follow-up. So during the next follow-up, no new symptom had appeared when she reported in the subsequent follow-up. Mild improvement on face, but slight aggravation on eruption on both cheeks with mild pain and itching. Moderate improvement on forehead. I have prescribed sulfur 200 only single dose state only. Followed by placebo 4 pills TDS 8 hourly. Um, for 10 days only. The next time the general management I have given to my patient during the second follow up, do not pick or squeeze pimples because it may worsen acne and cause skin swelling and scarring. It can cause lesion to become infected. Wash your face no more than twice daily using a gentle no soap facial skin cleanser and warm water. So during the third follow-up, the eruption gradually decreasing, marked improvement on forehead and cheeks, no itching and redness, complete relief in the symptoms, and the skin lesion resolves permanently. So the overall improvement in the patient was noted with sulfur. Hence, she was kept on placebo and she was advised to report only if symptoms reoccurred. So I have prescribed placebo TDS for 5 days only. So acne has made this patient not only look ugly but also feel ugly. So it has hit right on her self confidence due to chronicity of the complaints. She has given up the hope of recovery, which is aptly covered by sulfur. So considering the mental and the physical journal, the final drug of choice is sulfur. So sulfur was selected on the basis of totality. So in the repertorial sheet, so in the repertorial totality, sulfur scored the highest marks, which means how the most simillimum with the patient complaint, and also suited for the patient have popular papular pustular eruption on face as the sulfur is a deep acting remedy, so high potency was not prescribed and not repeated frequently, gave relief to the patient in short duration. So, thank you so much for staying with us. We will be starting the question answer session. So, I'm going to request my viewers write down your question if you have. So, basically, okay. So, we will begin the question answer round. Now, I would like to request all the viewers to comment in the chat box with their questions now. So, a learner wants to know the first question I'm going to take. A learner wants to know, can stress cause acne? Basically, stress does not cause acne, but it can intensify your acne. So this is the correct answer is stress does not cause acne, but it can intensify your acne. Okay. Now I'm going to take the next question from a viewer side is, does acne run in families? Yes, having a close relative with acne, such as parents or siblings, may mean you are more likely to have breakouts and predisposition to adult acne. The another question from a viewer side is, does drinking water help acne? Acne occurs in oily skin basically. However, drinking water helps flush out oxidants or hydrate your skin. It can also help prevent dryness, which is an outcome of acne medication. So this is the answer of your question, correct answer. So the next question I'm going to take, Lana wants to know, what age can you get acne? Basically, acne can occur at any age, but it is generally more common in adolescents and young adults. Acne symptoms commonly start showing between the ages of 10 to 13 years. I think we have almost taken up all the question. So let's take the last question from a viewer side is, can I use makeup if I have acne? Yes, you can wear light makeup, but it's probably best to avoid it entirely if you can. Choose your products carefully, that is, preferably use non comedogenic back makeup. Wash your face twice a day with gentle cleanser with no soap, and after sweating, clean your face or wash your face. Always remove makeup before going to bed or before going to sleep. Okay, so let's wind up here. Thank you, everyone. I would like to thank all the viewers and the homeopathic fraternity who have joined us here today. Thank you. Thank you so much. Have a great day. Keep learning, keep improving.